principals are present, ma'am?
Yes.
Yeah.
Thank you.
Should I start?
Yes. Please go ahead.
Yeah, so a very good evening to all of you. And I consider it to be a very much proud privilege on behalf of Bengal Obstetric Gynecological Society with all the esteemed members out here and the school principals and the students at the foremost. And we have with us a psychologist, a renowned psychologist, and who is a member of the Psychiatric Society and also a member of Antara, and school teacher. We have Shomdata ma'am. And actually 2 months before, I did a program of public awareness with the school, and then I promised them that we will be getting back with a bigger forum, and this is the day. And now, without wasting much time, just a small introduction from our side. We have Dr. Ram Prasad Dey, the Secretary of Bengal Obstetric Gynecological Society, Dr. Abhinash Chandra Roy, myself, and Dr. Bashum Mukherjee as Vice President of Bengal Obstetric Gynae Society. We have Dr. Pradeep Mitro and Dr. Bulbul Rai Chaudhary as advisor of the Public Awareness Committee of the Bengal Obstetric Gynecological Society, who is hosting this program. We have Dr. Shokha Chakraborty, Dr. Nirmala Pripara as chairpersons of this Public Awareness Committee, Dr. Bipasha Sen and Dr. Suranjan Chakraborty as the secretary of this Public Awareness Committee. And the invited guest, as I have already said, Dr. Shomdata Banerjee. And from the side of the school, we have the CEO with whom I coordinated initially for the program, Shoma Devnath. And I'm so much grateful to her, the principal of the Saini International Group of School, Howrah, Navnita Giri. And from Mahershala, we have the principal, GM Lina, and the two coordinators from Howrah. We have Sanjita Ashkar and Diya Dash. And we have the adolescent group of all the students. We know that this adolescent represents an inner emotional upheaval and a struggle between the eternal human wish to cling to the past and equally a powerful wish to go on with the future. So, hope this will be a very good program and you will all enjoy with a lot of take-home message. We have eminent panelists of gynecologists. They're all well-known gynecologists of Kolkata. So I request first our secretary from Bengal Obstetric Gynecological Society to give the welcome address.
Yes.
Ram Prasad.
Thank you. Thank you, Dr. Mousumi De Banerjee. Am I audible? I hope so. Yes. Good evening to everybody. Respected Principal Madam Nabanita Giri from Howrah Saini International Group of School and GM Dina from Mahestara branch, as well as the Chief Executive Officer Shoma Devnath, teachers of these two schools, students, and also viewers, and definitely our faculties from Bengal Obstetrics and Gynecology Society, our three vice presidents, as well as the chairpersons, and also the advisor of the Public Awareness Committee of the Bengal Obstetrics and Gynecological Society. As a secretary of Bengal Obstetrics and Gynecological Society, I welcome you all to this health awareness program organized by Saini International School, Saini Group of International School, associated with the Bengal Obstetrics and Gynecological Society. At the outset, I mentioned that Bengal Obstetrics and Gynecological Society is a very old society. It is established in 1936, and it is a highest level of academic body in the women's health, and affiliated to nationally the FOGSI, that is Federation of Obstetrics and Gynecological Society, as well as internationally FIGO. Our society was established in 1936, and the insignificance of this establishment, our primary objective was the improvement of the human health, as well as some of the social activities in the form of health awareness camp, health awareness program, public awareness program, as well as the mental and social health of the adolescents group. We are doing for the last few years the different physical programs in the physical programs in the different schools, but due to pandemic it is now right now not possible. School also not also in the regular form. So we have taken this e-platform or virtual platform to conduct these health awareness programs. I hope the students and the viewers will be benefited from this type of health awareness programs, so that they may have some queries and that will be resolved. We have a galaxy of faculties. We are the very learned faculties from our Bengal Obstetrics and Gynecological Society. I wish this program will be a grand success. And thank you all the our organizers and the Saini Group of International Schools who has given us the opportunity to conduct this health awareness program. Yes, thank you all. Over to Dr. Basu Mukherjee, who is the conductor of this moderator of this health awareness program. Thank you.
Hello.
Hello.
Yes, actually, we have to give a few minutes to Dr. Avinash Chandra Roy, who is the Senior Vice President and the Vice President in charge of this Public Awareness Subcommittee of BOGS, to say a few words.
Thank you, Mousumi. Thank you very much. First of all, I thank to the organizers and the principals of the Saini International Schools, the faculties, the teachers, the students, everybody. One or two few words about our society, our beloved society, the Bengal Obstetrics and Gynecological Society, is that our aim is mainly two things. Number one, our academic improvement of our academic activity of the society, regarding update knowledge regarding our profession. And second one is the public awareness and health checkup in different places. Another one important point I want to highlight that our society provides student 5 students every year. They are economically less powerful in financial condition. We help them 5 medical students to complete their career MBBS. And another one thing already said my beloved secretary, that our is a great, biggest professional body, specialist body, about 37,000 members of our parent society. And to the students, I want to tell, you have come in this world through any or other member of our society. So we are very much actively involved and always want to help our society from which we belong. So over to Mousumi.
Now it is a turn of the coordinator from the Saini International Group of Schools, Ms. Shonjita Ashgar, to kindly deliver the welcome address and comments from your side, ma'am.
Thank you, ma'am. Good evening to everyone present. This is Sanjida Asgar, coordinator of Saini International School, previously known as MLZS Howrah. I would first of all like to extend a warm welcome to everyone present in this evening. We are very much thankful to Dr. Moshimi Banerjee, an eminent gynecologist and obstetrician, second vice president of Bengal Obstetric and Gynecological Society, with whom we had a live session on adolescence health a few months back, and it was an enriching session. As the speaker of the session, she had enlightened the gathering with her rich knowledge and vast experience, commenting on various issues and ending it with an interactive session with our students. The session was successfully conducted, and Moshmi ma'am promised us that we will have another session with her and other renowned and eminent team of doctors on a bigger platform. And we are here today. Thank you, ma'am. Today's session on health awareness is conducted by Public Awareness Committee a subcommittee of one of the most renowned committee of Bengal Obstetric and Gynecological Society. We feel privileged in the presence of such esteemed faculty, and on behalf of our CEO, Saini Educational Trust, Shoma Debnath Ma'am, Principal of Saini International School, Howrah, Nobinita Ma'am, Principal of Saini International School, Mahesh Talla, GM Leena Ma'am, and our students, I wholeheartedly welcome the panel of renowned doctors and psychologists today. We welcome each and every member present today. It's a privilege for us to have you all here today and have the opportunity to be a part of the program. We welcome Dr. Ram Prasad Dev, Honorary Secretary of BOGS, Dr. Abhinash Chandra Rai, Senior Vice President BOGS, Dr. Maushami De Banerjee, Second Vice President BOGS, Dr. Bashab Mukherjee, Third Vice President BOGS, Dr. Pradeep Kumar Mitra, Advisor, Public Awareness Committee, BOGS, Dr. Bulbul Rai Chaudhary, Advisor, Public Awareness Committee, BOGS, Dr. Saktiripa Chakrabarti, Chairperson, Public Awareness, Dr. Nirmala Pipara, Chairperson, Public Awareness Committee, BOGS, Dr. Bipasha Sen, Secretary, Public Awareness Committee, BOGS, Dr. Shuranjan Chakrabarti, Managing Committee Member, BOGS, and Ms. Shomdatta Banerjee, Clinical Psychologist. It's a privilege for us to have you all here today and have the opportunity to be part of the program. Our students will sure have a very good learning experience today by being a part of this webinar and listening to the eminent speakers present today. Thank you, ma'am.
Thank you for your kind words. Now, without wasting much time, over to Basho. He is always an excellent moderator and nicely moderates this panel. So, Basho, kindly for moderating this panel.
Thank you very much. Thank you, Dr. Maushami De Banerjee. A very warm welcome to all our students who are attending here, and we hope that the next 1 hour will be very fruitful for you, and we can leave you with some good health messages, and you can have some good take backs at the end of the session. So I'm going to start screen sharing. I have a presentation here, and we will start it from here. So let me ask the most common question, which we ask everybody now. Can you see my screen and can you hear me?
Yes, sir.
Yes,
Yes.
Very good.
Yes, sir.
Yes, so the first two blanket rules which we have for everybody whenever we have webinars is please keep yourself on the mute at all times. Make sure there's no background noise which is coming into and disturbing the program. And we also would like you to put in your comments and your questions and queries in the chat box throughout the program at any point of time when you feel that you have some pressing questions or some comments to ask on the proceedings. Please be free to use the chat box and please put in your questions. So we are here a group of doctors. So here we are the people who do operations. Yes, we are the one who see patients in clinics. And the question may naturally come, what are we doing in a school? So what we are doing in a school, I think, which was explained here, is we are trying to promote some health awareness, give you some tips on how to maintain good health, some which you already know, some which will be, we hope will be educational, and you can get some important messages. So the greatest enemy of knowledge is not ignorance, it is the illusion of knowledge, said Stephen Hawking. That sometimes we do not know enough, we think we know, and that thinking we know is sometimes much more dangerous than not knowing at all. So the sources of health information which you get as students, or even the teachers who are attending this session, who we normally get, or the non-medics, if I want to put them in one basket, would be through the internet. That is one of the most common sources of health information. Why health? Any information in the world you would like to search in a Google. Magazines, there are health magazines. Now people don't read magazines much, but still it's all there. There are books, there are friends, there is family, there's a television. The television, of course, has so much of discussions on different health topics. There are medicine shops. So a lot of people, when you go to buy medicines, they try to get some information of medicine from the pharmacist who's there over the counter. And then there is self-belief. people who are sure that this must be right. There is no other way it can be wrong. And that is something which is often dangerous. The problem with most of this health information, it is unfiltered, it is unregulated, and it is sometimes not true. And it is almost impossible for you to differentiate what is true and what is not true. And that is the reason why we are here in the health awareness meeting. Here we want to give you some very important and very clear messages. So what would you expect from this session over the next 1 hour? Over the next 1 hour, all our experts which we have here, senior doctors from the society, would like to run you through simplifying complex medical jargon. You may have heard of cysts, you may have heard of tumors, you may be heard of some other medical terms. We would like to simplify them for you. Some tips for a healthy living. After all, it's so important to be healthy first, and after that, everything else. Focus on preventive health care. We know prevention is better than cure, and you know that you really prevent problems from happening in the first place before they actually take place. Quashing myths and misconceptions. There are so many myths and misconceptions when we take about different health topics, and we would be addressing some of them today. Of course, we won't be addressing everything in the world, but at least some of the issues which we would like to focus. We hope that you would be able to take some good messages. And the answer, of course, do I need to see a doctor? So many things happen to us in our day-to-day life. Sometimes a stomach ache, sometimes a headache, sometimes something else. And what are the issues where I need to see a doctor? When can I just stay at home? I think it should settle by itself, and that is what we are going to discuss. So the first, so look for something positive in each day, even if some days you have to look a little harder. And I think today is a day where we try to spend the next 1 hour. Keep on interacting with us. Put in your thoughts in the chat box. We will be coming to the chat box from time to time when we get your information and share it in this forum. So let's start with the topic. We'll start with a condition which I think is very common in India. We understand that we have girls and boys in the school, and so we will be from time to time putting up case scenarios and discussions pertaining both to the girls as well as boys. So here we have a 16-year-old Miss KG. We have hidden the name, of course, because we want to maintain confidentiality. So she is complaining of heavy bleeding during her periods. So her menstrual periods, she has more bleeding, and that's happening for the last 1 year. And as a result of that, she feels extremely tired soon after her periods and has been absent almost regularly for 2 to 3 days each month in the last 1 year that she's having a problem. There's another issue that 17-year-old Mr. MS, he's a male student, and sorry. This never comes. Yeah, I'm good, sorry. 17-year-old Mrs. MS feels tired after a little exertion. He does not eat the right food at the right time and gets distracted from studies easily. He also has recently noted worms in stools. So with this, just a minute, yeah. Just a minute, am I back? Yeah, I'm back, yeah. So with this background, let us try to get some discussion from our experts. I'll stop screen sharing. I'll go back to our panel of experts. We have them there. Dr. Moushumi Banerjee, I think I can see you first here. Would you like to comment on this issue? We have two separate students, one girl student, one boy student, who's having problems of with supposedly anemia. Would you like to have some discussion on that, please? You are muted. You're muted. You're muted. Yeah.
Yeah, anemia is very common in India, and this worm infestation is very common. You know, especially the hookworm infestation in the rural Bengal is all, and also we find we take a lot of salads right from there. We can have worm infestation. So this is one of the cause. And moreover, when the child starts menstruation, there is periodic loss of menstrual blood every cycle. So we should check anemia. And if we have anemia, we cannot perform very well, neither in the studies nor physically. So anemia should be corrected.
Thank you, Dr. Moushumi. Dr. Pradeep Mitra, we have a senior doctor, past president of Bengal Society, Dr. Pradeep Mitra with us. Pradeep da, we want to hear some inputs from you. How important and serious is anemia? And what is your message for the students here?
First of all, it's a very important issue for almost all the schoolgirls there, particularly in the rural Bengal, as we find. So, if what is excess menstruation? What is excess bleeding? Proper history taking is the must. This part is very important. Excess bleeding means what amount of bleeding is excess to the girl, and what makes her so much of anemic and make her weak, and etc. etc. So that message that she or her teacher must know what is meant by excess bleeding. That is point number one. If that excess bleeding corroborates with our clinical experience that yes, really it's excess bleeding, then a thorough clinical examination, she should consult a physician for a thorough clinical examination. In both the cases, of course, the other one is a hook-on infestation, a suspected hook-on infestation, as we presume. A thorough clinical examination and some blood test should be done. I feel. Complete hemogram should be done to check whether this anemia is exactly due to this excessive blood loss or due to some of the reasons, and he or she would be treated accordingly. Apart from blood, stool examination is mandatory, in any case of suspected anemia. So this is the
Thank you very
basic
much,
message.
Purna. Thank you very much. I'll go over to Dr. Nirmala Pepara. Nirmala Ding, we want to hear from you. We are talking about anemia. We're talking about different problems. We're talking about both men and women. If you can just help us to understand that we have heard from Dr. Pradeep Mitra about how we should take a detailed history about anemia. But if you can just help us to share us how to move it.
Going into the further,
detect it. Yes, please.
Going into the further details, I will inquire how many pads she are using. Normally, the person should use 3 to 4 pads per day, but if it is more than that, one should be directed that there is excessive vaginal bleeding. So after doing the hemoglobin examination also, we can judge how much is the amount of blood loss. And as far as the boys are concerned, we should stress on healthy lifestyle so that they take the food at the right time, in the right amount, at the right sufficient amount of sleep is also important. Because of the mobile phones and internet facilities, now they are not keeping proper time, not taking proper food, taking a lot of fast food, so that everybody is ending up in mild to moderate anemia. We should emphasize on healthy lifestyle and taking the nutrition at right moment. Fruit should be supplemented, fast food should be avoided as far as possible.
Yeah, so I'll just go back to my slide screening because we have some questions in the chat box. And the first question is, of course, what is anemia, how to detect anemia. So anemia, as we heard from experts, is the decreased production of red blood cells in the body. And the reasons are many. It is not that it is one reason, there are many reasons, but one of the reasons which is most common and treatable is iron deficiency. So iron deficiency is a very common cause of anemia, and that can be due to 2-3 reasons. One is because of increased blood loss. In girls, there is a reason for blood loss because they're having periods every month. So there you can have more blood loss. In boys, usually you don't have blood loss as such, but you may have poor nutrition, and that is a common cause. And that's what we will be highlighting on what are the iron-rich food which you need to have, which can increase your hemoglobin. And worm infestation also is a cause which we have heard from Dr. Pradeep Mitra that is one of the reasons for anemia. It is a very common problem in India. 1 out of 2 women in India are anemic, possibly even more in the rural area. And what are the common reasons? What are the common symptoms what a person may feel? It is tiredness, it is fatigability, it is irritability, it is palpitation, that is the heart beating fast when you're either having some simple activity, just going up a stairs, and suddenly you feel breathless, you feel your heart is beating fast. And this all could be signs of less blood in your body or anemia. So there could be hair loss, there could be poor appetite, there could be lack of concentration in studies, as simple as that. And one of the different reasons is anemia. So iron-rich food in the diet is recommended, and the hemoglobin level which should be there in adolescence is roughly around 12. And that comes to the question, how many of you boys and girls have checked your hemoglobin levels? And that is something very basic. You must know what your hemoglobin levels are, and hemoglobin is one of the ways in which we can assess anemia. So which is the food rich in iron? This is the food which is rich in iron. You have the broccoli, you have the cabbage, you have the cauliflower, you have a lot of vegetables, things which you normally do not have in many cases, and you've got some fish and some banana and a lot of carrots, brinjal, and all these are food rich in iron. If you want to prevent anemia and if you want to be healthy, this is something which we can look into. So I'll stop sharing again. I'll go back to our panelists out there. Can we hear from Dr. Avinash Chandra Rai? Avinash da, we want to hear from you. And we want to hear from you about anemia, the problem in the country among girls and boys, and how can we take care of it?
First of all, Basov, it is most important thing in our country, in India, is nutritional anemia. That is the most important thing. And regarding nutritional anemia, iron deficiency anemia is one of them. Cause of iron deficiency anemia is definitely due to the food habit, number one. As you have shown, the iron-rich food, if anybody has don't take that balanced diet or food, there is every chance of anemia. And another one thing regarding blood loss, as Mousami told, the hookworm infection is very common in our country because particularly the rural India people, they work in the outside, in the paddy fields or everywhere. There is every chance of getting the hookworm. Only one hookworm takes 0.1 or 2 ml of blood per day. So just think how much hookworm can make a patient very much anemic. And another two things, as you have already mentioned, blood loss. If there is blood loss constant, whatever you give the iron or there will be chance of anemia. So you have to stop the blood loss first and then to give diet and proper medication after investigation.
Thank you very much. Thank you. Shiranjan, I want to come to you, Dr. Shiranjan Chakraborty. We want you to, there is a question on what is the meaning of adolescent. So could you like to highlight what is adolescent? Where is Dr. Shiranjan Chakraborty? I think I lost him. Shiranjan, are you there? Yeah, you are there. Just a minute. You are unmuted, but I can't see you. Your video has gone off.
Bashut, could I say one point before we move out of the subject, Bashut?
Yeah, no, we haven't moved out
Bashut,
of the subject.
I want to highlight one point.
Yes, we haven't moved out of the subject, Shoktirupati.
About
I'll come to you
anemia?
in a minute. I know, I will come to you in a minute.
Okay.
I'll come to you in a minute.
Okay.
I can't get Shiranjan da. His
Sure.
video is off. His video is off. I'll go back to my screen sharing. We will, no, the video is off. So we're just going back to screen sharing. We'll just go to some other points before we come back to you. And the next points are on nutrition. So a man is, you are what you eat. That's something which we say, you are what you eat. And in the nutrition, though it may seem a little bit boring, or it may seem a topic which may not be very desirable, but this unfortunately seems to be the most important aspect of health. Even after becoming doctors and even after knowing a lot of things about medicines and operations to treat diseases, we do understand that it goes back to what you eat. So many times when we sit in our clinics, we talk to our patients, we tell them, ki khabar khachen, what food are you having? Kya khana kha rahe? And then it all starts back to what you actually have. So here we have two case scenarios for you. There's a 14-year-old Miss GJ. She does not like homemade food. Fried chips and burgers are her favorite. She often brings the same to school and shares it with her friends. Then there's a 13-year-old Mr. LS. He loves food, especially from the fast food shops. He hardly has any fruits. Maximum it's once a week, and vegetables rarely. His parents have recently noted that he's gaining weight and are obviously concerned. So this is, I'll stop sharing again. I'll go back to our panel. Dr. Shoktirupa Chakraborty, now I'll get back to you. Shoktirupati, we want your inputs here. We are discussing about a very serious problem about eating the right food, and how important would that be? Can you just share your perspective on this, please?
It is a very important point, Mashu. Thank you. You have raised this point. This growing boys and girls nowadays, they are having this fast food, and usually these rolls and biryanis and burgers and all this chicken, they are also injected with estrogen, these external hormones, and thus in the body there is excess of hormones. As it is hormone, there is a storm of hormones during the adolescent period, and over and above these hormones, they just do not allow the normal hormones to act properly, and thus the excess hormones create a problem of obesity, and the obesity leading to the cyclic problems. And about the boys, what I was saying is, they might be having blood loss due to constipation. This is applicable to both girls and boys. They wake up so late, they stay overnight awake and wake up late, and then what they have to skip is going for motion. And thus, after 4-5 days, they go for motion, they just strain, and then they develop piles, and then start having piles bleeding. These piles also have a great cause of concern of anemia. And so I was saying, and our country, besides you school children, you come of good families, but poor families, they eat a lot of rice to fill up their stomach. So we have to come to a balance in between the two. And especially nowadays with this COVID and all, we would advise you not to have food from outside. You have good balanced diet. Little protein.
Fair enough. Thank you, Shokhiravadi, for your inputs. We'll go to Dr. Bipasha Sen. Bipasha, are you there? Dr. Bipasha Sen, I can't see
Yes,
her.
I am here. I am here.
Can you just make yourself prominent? Yes, fine. Thank you. So we want to go with the same topic which we are going through. We're going through food, and the problem that generally is. Just a minute. I'm not getting you on the. Yeah. No, I'm not getting the pin correct. Just a minute. Yeah. So fine. So just tell me. Dr. Shokhirupa Chakraborty very clearly mentioned, don't have fast food, don't have outside food. But how practical it is for an adolescent person of the age of 11 to 19, where you're seeing all the colorful side of world, which is outside your home kitchen, and you are told to have your home food and just to stick to it. How difficult it is, how practical it is it really, can you say a big no-no, or can you say a little bit of restriction, or exactly how can you really advise them? You really can't say don't have food. That will make life black and white and without all color. What is your take on it, Dr. Bipasha?
To be very practical, it can never be a big no-no, but we have to make these students aware that about the harmful effects of the fast foods. We have to tell them, and definitely some of them nowadays we are getting polycystic ovary in a big way, of which one main reason is fast food. And we have to advise them that, okay, apart from roll, burger, you can have some cakes, some puffed rice like muri, these things, biscuits. These are not harmful at all. These are not home food. These are outside food, but still these are not that harmful as the fried chips, burgers, and rolls are. We have to advise them. They can, of course, they can take once or twice a month or thrice a month. That is okay. That is permissible. That won't affect their physiology much, but on a regular basis, if they make it a habit of taking these rolls and these fried chips and all, especially while on TV or while on internet, now they are doing online classes and all, while on computer, if they make it a habit of munching on these fast foods continuously, that will affect their health. And if they are, some of them do have irregular problems in periods. There is irregularity in period, and if she gains weight, then and if polycystic ovary is somehow detected, then of course for that particular person, we have to say that fast food is a big no-no.
Thank you very much. Thank you, Dr. Bipasha. I think we'll go back to our screen sharing, and we will go back to some more slides, and then I will take the questions which are coming into the chat box. A lot of questions are not exactly on the topic we're discussing. It doesn't have to be. It just can be any of your problems. This is the time when you've got a lot of doctors in front of you. Just keep on pouring your thoughts, and I promise to answer every question which is coming in the chat box. Every question will be answered. So be free and just keep on putting your questions. From time to time, we'll be taking your chat box questions. So nutrition, making healthy choices. Good nutrition is critical during the teenage years, ensuring healthy growth and development. That's what we are saying. That's what we are stressing on. The healthy diet must meet the changing nutritional needs of a growing teenager. So as a teenager, as an adolescent, that is a person of the age group around 11 to 19, let's say, you would need a lot of nutrients in your food. That means proteins, carbohydrates, fats, minerals, and vitamins, and all of that together. So what the problem of fast food is, they do not contain enough of vitamins and proteins, and mainly the high calories can help in can cause weight gain and a lot of other health issues. Never skip meals. Exercise for 30 minutes a day. Try not to starve yourself. There's some of people who like to lose weight by not having food at all, and that's very unhealthy. Reduce carbohydrates to 40% of your calories. 3 meals and 3 snacks could be one of the suggestions. So say yes to fruits at least once a day, if not alternate days. Fruits is good. Milk is a very good thing, and some greens. I think would be nice to see some green, a colorful plate with some greens on it. Yes, it's absolutely not that you have absolutely no. You can have a burger, you can go to McDonald's, you can go to Burger King, maybe once a week or maybe once in 2 weeks. But as Dr. Bipasha Sen very clearly said, if you make it a habit, it is something which will be harmful. So before I go on to the next topic, which we will be discussing, I would like to take some of the questions and run through them. What are the symptoms of anemia in males? I think we've discussed that. Lethargy, poor lack of concentration, tiredness, fatigability. What is the meaning of adolescence? It's a 10 to 19-year age group. Color of menstrual bleeding may an important role of symptom of anemia. Bipashadi, you're here, and can I just pass this question to you? Does the color of the blood during periods have any indication of whether a woman or whether a girl is having anemia or not?
Actually, in anemia, there is excessive blood loss. And if there is excessive blood loss, then that will cause anemia. The color itself is not indicative of anemia. But of course, if she has got less blood, the color that will be faint red initially, but not throughout the period.
But not so much. Yeah, I think we agree with you. Like there'll be a lot of, like, as we said that, as Dr. Nirmala Pipara had said, that if you're changing more than 3 pads a day, that is an indication you're losing a lot of blood. And also if you're passing clots, if you're passing big solid chunks of blood, in that case, you definitely would be if you so if it's clots which are going through the periods, then there is a chance that you're losing a lot of blood knowingly, unknowingly, and that will make you weak, and that is something which you need to get checked out. About dysmenorrhea or pain during periods, that's a question which has come. I'll go to Dr. Nirmala Pipara. Nirmala Di, this is a question which we're not addressing here, but it has come up here about how to why do people get pain during periods, stomach pain, back pain, leg pain, and would you like to highlight that, please?
Pain during menstruation is quite common. Every alternate patient will say that she is having pain, but usually it is tolerable. The pain which does not interfere with the normal lifestyle of the person is a normal menstrual pain. The pain which is relieved by taking a mild analgesic is also a normal pain. It cannot be a pathological one, but the pain which is not relieved by taking medicine, one should alert to seek a medical advice, because if there is any pathology inside, the pain will not be relieved and it requires medical attention.
Very good. Very well said. I think that's a very important messages going across. Dr. Pradeep Mitra, Pradeep, we'll come to you. There are a few questions here, and we'll just take your inputs here. There's one person who's asking about why is there pain in the kidney due to erection? Is there any reason for pain in the kidney due to erection? There's one boy has shared this issue with us, and there's also a question about how to become intelligent. So I want to give you both these questions. Pain in the kidney during erection and how to become intelligent. If you just like to highlight some points, please.
The first question is saying that he's having pain in the kidneys. Actually, where the pain it is it actually in the back, upper part of the back, in the loin, or in the suprapubic region? Is it bladder pain, or it is really a kidney pain? So, defining the pain is most important. I don't know whether he's having pain in the loin, in the kidney region at all, in the renal angle, or in the suprapubic region. So that is to be known first. So as such, it is not related to kidney pain. Erection has got nothing to do with kidney pain. So that is the message from me. And second point, what you said.
How to become intelligent? How to become intelligent? There's a smart boy who's asked us. Is there any special? Is the Brainolia any special tonic? As a doctor, are you loaded with some special knowledge, which you can render to the students, where they can become super smart and super brainy?
My dear sweet boy, there is no medicine in the world which can improve your intelligence. It is genetically transmitted. Apart from that, you can improve your intelligence by dedication. That is the only way out, what I feel. And what I tell to my kids, told to my kids from their younger days. There is no medicine in your dedication, your exercise, your avoidance of bad habits. You know what are the good habits, what are the bad habits, your dedication to your studies and all those things. Repeat studying repeatedly. If you forget it, those are things, those are the exercises which can improve your brain function. Along with, of course, meditation and other things may come up. Little bit of meditation, little bit of exercise, right thought, right thinking. Those things will improve your intelligence.
Thank you, thank you, Purita. I can't see Dr. Moushumi Debanji. Dr. Moushumi, can you please identify yourself? And we want to see you. So here, I believe that, like you did mention, that you had taken a class on or taken a discussion on polycystic ovary. So there are a few questions on polycystic ovary. Dr. Moushumi Debanji, are you here? I can't see Moushumi. Yes, I can see her, but is she busy? I can't see her. She's not on the. The video is not on. Okay, so I'll go back to Nirmaladi, yes, Nirmaladi, I'll go back to you. The question which I'm asking you is, there is a question, many questions on polycystic ovary. What is the solution for cysts in ovary or polycystic ovary? Unwanted hair growth on the face, not having period regularly, irregular periods. So how would you like to address just many of these things together? Can you just put them together, and what small short messages on polycystic ovary problems in girls? We're not covering it in a slide, so we want your inputs, and now we'll move on to the next topic.
Hello.
Yes, I've muted Dr. Moushumi. Yes. Yeah.
He has come. Dr. Moushumi has come.
No, I can't see her. But please continue.
About
polycystic ovaries, yeah.
Polycystic ovaries is very commonly seen nowadays. It is because of the number one, what is the age of the person, what is the weight of the person, and what is the lifestyle of the person. If the person is little obese, having a lot of hair, then we should think of polycystic ovaries. And advices will include, number one, to reduce the weight, number two, to take the healthy lifestyle, and number three, daily exercises and proper diet should be encouraged.
Yeah. So I think very important points is that the cysts which are there in the polycystic ovary do not need a surgery or an operation. That is point number one. It is the medical problem essentially. Around 50 to 60% of women who have polycystic ovary have increased weight gain or overweight, and they have to reduce weight. People who are normal weight, there is nothing to reduce. The entire treatment would depend on whether you have irregular periods, whether you have excess hair growth, and in that case, different types of treatment are established by different doctors. It may be hormonal, it may be non-hormonal, but these are things to be discussed in a clinic. And if the problems are persistent, of course, you need to go and show a doctor. There is a question, Nirmaladi, you're here, is what diet to have during the time of periods? Then I'll go to Shukti.
The
What
person,
diet during the time of periods?
the person
Yeah.
should take a normal diet. Whatever is her routine, she can take a normal diet. But the diet should be rich in proteins, vitamins, and minerals, because most of the fast foods which the students are normally consuming are having a lot of fat and carbohydrates, but they basically there is less of vitamins, minerals. So we should encourage them to take more of fruits, and the fruits and vegetables and dinner, lunch, everything should be taken at the proper time. They should take a sleep of minimum 6 to 8 hours, go to bed by 11 o'clock and wake up by 6 o'clock, because most of these girls are waking up at 9 or 10 o'clock in the morning. So a healthy lifestyle, a healthy weight reduction should be encouraged in them, and if required, the doctor should prescribe medicines which can help her to reduce the polycystic ovarian disease. And most of the patients, about 70% of the patient, will improve with simple medical treatment only. They won't require any surgery. It is actually a misnomer. It is a misnomer in the sense it is not a cyst or a tumor. It is the small pearl-like thing in the ovary where the ovulated follicles have not ruptured. So we should counsel them that there is nothing to worry, and they will be all right if we follow the proper medical advices.
Thank you, Nirmaladi. Dr. Shukti Rupa Chakraborty, we'll come to you. There is a question, what is UTI and how can it be prevented? So what is UTI? We said we'll be cutting on medical jargon. This is a student who has heard about the term UTI. What does the UTI stand for and how can it be prevented?
UTI means urinary tract infection. But that too, she or he won't know whether it is urinary tract infection. This actually her or his symptom is burning during micturition. I think most probably, and you should have plenty of water to drink always, and you have to keep your normal hygiene. For the girls, I tell you, your underwears should not be made out of synthetic material, because our country being a hot country, if the undergarment is always wet due to perspiration, it invites infection. And you should not wear very tight and synthetic garments. Like these days we see you wearing jeans, and the tight fitting jeans, and I don't know whether you wash them every day or not, monthly, you are wearing them every 4 5 days, but that should not be, and your sanitary napkins have to be properly used. At least, even if it is not wet, you should not wear the same pad throughout the day. At least you must change them. And during the rainy season, if the undergarments are not dry enough, you can iron them. You have to maintain proper hygiene, clean them properly, dry them properly, and after going to the bathroom, you have to dry that area with tissue paper or towel. You have to dry your part, and then if still it is there, you can see the doctor, do urinary culture and sensitivity, and find out actually whether you are having an infection or not, and treat it accordingly.
Thank you, Shukri. I'll just go back to the screen sharing. I think we have more issues to discuss. We have with us a very renowned psychologist, and we have some issues in that department which we will be taking on. So very important points which are going across. What choices in food do you make? So girls and boys, I think that's a very important thing. I said that even as doctors, even as when we talk to our patients, when we talk to patients who are sick, it all starts from what food you are taking. So this is, now we're shifting from nutrition. Now we're shifting to another very
Bashar,
interesting area of discussion. Yes.
Bashar,
think
just
we'll,
just
yeah.
one point. I just want to say, actually, you know, according to a dietitian, they just said it's difficult for us to measure and have protein, carbohydrate, but they said that you have your feast size carbohydrate, your palm size protein, and half of your plate should be covered by salads and vegetables of different colors of the season. So this is just a small thing that I want to give a message over.
Thank you. I think we'll move on from nutrition. We'll move on to something else. So here is it. These are different types of people who are standing there. I wish I was skinny. I am too skinny. I hate my big butt. I am too fat. My chest is too big. I am too short. I hate my fat stomach. I am too flat chested. I wish I looked like her. I have fat thighs. I hate my body. So this is something I think which is a very important issue in adolescent body image. Why can't I be perfect? Mr. PK, he's around, let's say, 16 years old. He's ashamed that he's just 5 feet 2 inches tall, where his other friends in his friend circle are closer to 6 feet. They play basketball, but he just has to sit on the sides. He feels dejected and sad with this. The Mrs. RC, she's around 17. She feels lonely in front of her friends as her breasts are small in size. She finds it difficult to concentrate on her studies, and this plays on her mind. So we have two issues of different kinds when it comes to the body, and it's something which we really want to take care of it. So I would like to bring our psychologist today, Ms. Somdatta Banerjee. How serious are the issues of body and mind in the young adults? How can we counsel them? Who are the best people to talk to them? And how much is the society and the demands of the society responsible for this thinking? So I'll just stop sharing my screen now. I'll go back to our experts. Can Ms. Somdatta Banerjee make herself prominent, please? Can I cannot see. I cannot see her. Dr. Moushumi, can you just get her back, please?
She was here. I'm just calling her.
Yeah, she was here, but I cannot see her. She was the co-host. She should have been very much prominently there in the beginning. This is the time for her to. She can join back in case she's not there. So so let me get Abhinashda. Abhinashda, we haven't heard, Abhinashda, we haven't heard from him in some time.
Yes.
Can you start the discussion on body image? We want to really find out how important these issues are, and then we'll get Somdatta to highlight this again. Yeah.
Bashav, regarding development, if there is some problem, there might be some change in the body, in anybody. But the thing is, after doing some schooling and education, anybody and everybody can become to the in the world a successful person. So for body, if anybody has lower size breast, so it can be, she should know that it can be at par after having lactation and like that. So another one thing is regarding the beauty. It is God given actually the health. So she can by food, by exercise, she can make her health or body up to the appropriate level. So if anybody thinks why I am not becoming fast, there is in a school only one girl or one boy become fast. So it is no sense of struggling regarding this matter and give her herself painful situation in herself.
Abhinashda, we'll just come back to you. Abhinashda, I think somebody is scrambled. Somdatta, before you start, I'll just try to run through what we were discussing. We were discussing body image. This was the first slide which I showed, and this is what I had discussed about two case discussions about one boy being short and one girl having short, small sized breasts, and how serious are the issues of body and mind in young adults. How can we really counsel them? Because some of these issues are not something which will be sorted out. They will be like that throughout life, but you have to understand each one is different. Who are the best people to talk to, and how much is society and the demands of society responsible? So if we're talking about the body image first, if you can just come in, I'll just stop screen sharing, and we want your inputs of how exactly you think, how important it is, and how can we can't see you.
Bashar Shondatte is back.
No, but we can't see her.
Yeah.
Just a minute.
First, very good evening to everyone present, all the eminent doctors, principal, teachers, and a bunch of beautiful students. There was a little bit of network problem, so I just couldn't get back. Now, sir, coming to this point which we were discussing about body image, now this is a very important issue. Today we are talking about body image and body shaming for both boys and girls, especially during the adolescent age, that is the teenage. Now, what happens, the questions, they start thinking like this, that how am I being evaluated by the others or my friends? Are they going to look at me and say that, you know, you're a short one, or you have a dark complexion, or your hair is not like this? So we always, during the teenage, we start thinking like this, that we are getting evaluated and getting attention, how much attention we are getting from others. That is also very important. So this time it's very important, like we know for the adolescent children, those who are here in the session today, I'll tell you one thing, that we very well know how much social media, as well as the internet, all this Facebook, WhatsApp, all the other social media apps which are there, they always try to highlight this, you know, having a very attractive body or a zero figure. Or for the boys, I think many of them are doing rigorous exercise. Maybe they are not very much happy with the amount of food, as the doctors were saying just now. They were having they're mostly having street foods, and they're not being at all aware of actually in the long run or in the future, this is not going to do well. So this particular body image or body shaming is actually being taken by the, I'll say the media and the social media, especially the friends, the peer group, and the other in society. They play a very important role. So first thing is to obviously, as we know that mental health is so much important now, physically as well as to the physical health. So a thing has to be kept in mind that whenever we have some issue or we are thinking something, like better we talk to others, we talk to our friends, talk to our parents, if not parents, our friends or somebody with whom we are very comfortable or on whom we can develop that amount of trust. If I share something with him or her, he or she is going to give the trust. So about this body, physical structure and all this is just being portrayed by the society people or the others or friends or media like this, that we need to have a zero figure. But the children, the adolescent age, do not understand this, which actually in the long run, it becomes difficult in the future. So I think it's very much important that the child understand, and the parents, the near and dear ones who are there, teachers play a very important role as well. Talking to the teachers, sometimes some children are very comfortable with the teachers. If the teachers can explain beyond the class a little bit, that what is it actually? Why do we, like all of us, we during this age, we are very much aware of, like, you know, the friends and the peer circle. So you always try to think it like that we are getting evaluated by the peers. What the peers are going to tell about me. If I'm not look very pretty in a party, so obviously they are going to point that out. So that becomes very important. So this has to be, they need to talk to others, share their thinking and thoughts with others. Nothing to keep inside whenever they're not feeling like I need to talk with others. So just to come out with whatever is going on in the back of the mind.
Thank you, Shobha. I think we'll come back to you because we have some other issues there. Again, go back to screen sharing. So this was a body image problem which we have discussed, and it was very clearly put by Ms. Banerjee that there are people who need to counsel them, and there is a problem with demands of the society. There are other mind issues, I think, which play in a lot of students' mind, which we want to highlight here. There's a 14-year-old Mrs. SD. She's a mediocre student, while her elder sister, who used to study in the same school a few years ago, was a brilliant scholar and a gold medalist. SD gets upset as her parents and her teachers at school keep comparing her with her elder sister. She sometimes feels life is just not worth living. And there's a 16-year-old Mr. KM who's not as smart as his doctor parents. After trying his best, his marks are just above average. He feels he will not be able to live up to the expectations of his parents who really think of him to have a great future. These are not unusual situations. They are commonly seen in our schools today. Some of you can very well relate to something similar to this. And the question which I'm asking our psychologist expert here, what are the red flag signs to consult a psychologist? When do you think that you need some medical help? When are the things that you need some people to really look into? To consult. Would peer group or support group discussions be helpful? And can teachers at school contribute positively? This is what Shomdasa Banji has already explained, that yes, teachers are possible to talk about. Again, I'm going back. We're having a lot of distraction behind. I would request everybody to keep their mics on mute. This is really not Shomdasa, not you. We want you to speak, and but the rest of the people we would like to put to them. Yes, please go ahead. So we moved from body image. We want into some mental health issues or some mind issues. If you want to discuss them and try to.
Yes, sir. Thank you so much, sir. Thank you. Now the thing is that students, those who are in the webinar today, like what I am going to tell you, suggest you is that we know that mind and body goes together. They are like opposite side of the same coin. Now, sometimes it's not like this, that do not feel unhappy or sad. Everybody, all of us have problems in life. We have to cope with that. Every stage of life has got problems. We all face problems. So first thing is that we should think like this, that it's not, I am the only one who is facing problem. Everybody has problem and the solutions to problems. We have to look to those and get those solutions. Now, whenever, this is for the parents and the near and dear ones, I'll say, whenever we find a child, especially during adolescence, if the child is like, not behaving like how he or she was behaving before, like maybe he or she is not able to concentrate on his or her studies, or not being able to mix with her friends like previous days, he or she is just moving away from the routine daily activities. So there is a change in the behavioral pattern. That has to be noted. That easily can be like maybe once, twice, it's okay. But maybe it's over a week or maybe 10 days, but the child is not behaving like the child was behaving before. So there's a lot of change in the behavioral pattern. This has to be noted and taken care by the parents. They are very important role, as I said just now. Teachers should keep little bit of time for the children beyond their academics or just the studies. Like what is the problem with the child? Why the child, how he or she was before, why he or she is not behaving like this now? There must be something at the back of the mind. So teachers, they are very big role, and we know school is our second home. So they spend so much of time with the teachers and the friends. So they have to take a very big role in this particular thing.
Thank you very much. Let's move down. I think those are very important messages which went out there. I'll again start screen sharing. We'll go back to a couple of medical problems there now. The important problems, which there are a lot of questions coming in the chat box, is about menstruation and menstrual matters. We have with us Dr. Bipasha Sen. Bipasha, we haven't heard from you sometime. I'll get you on the. I'll get you to discuss about this. There is a lot of things about menstruation is not natural. It is to do with bad blood, dirty blood, and women have to have some restrictions during menstruation. There is a general, this is a UNICEF survey which shows 74% have pain, physical discomfort. A lot of questions in the chat box coming about pain during periods. There's a fear of staining clothes, embarrassment, and 93% girls missed 1 to 2 days of school on an average due for missing the periods. So FAQs on periods before we move forward. What is a normal period? I think Pradipda also was trying to highlight this point, Dr. Pradip Mitro. How long should bleeding last if the color of blood is not red? I think that's something which a lot of people would like to ask. When should I be worried if it's irregular? Is pain during periods normal, and can I take medicines? So Dr. Bipasha Sen, I'll start with you, and then I'll come to the other panelists here. So I can't see her. Yes, I can see her.
Yes, I am here. What is the first question is, what is normal period? Okay. Am I audible? Am I audible?
Yes, you are.
Yes, sir.
The first question in the slide is, what is normal period?
Yes.
So I must convey that normal period is 4 weeks, 28 days cycle. Ideally, it is normal period, but plus minus 7 days is also a normal period. That is 21 to 35 days interval is also normal. This is the interval. And duration, usually it stays for 4-5 days. That is normal. And usually on the first day, bleeding is very minimal bleeding. And second, third day, the bleeding is maximum. And then gradually it comes a bit less. And after 5 days, in some cases on 6th day, it disappeared. This much is normal period. And during the menstruation days, if you take especially on second or third day, if you change pads 3 times, it is also normal. This is the conception or concept of normal period. Anything else?
And what about the color of the blood?
Color of blood on the first day, it is a bit faint, whitish with tinge of red. Then from the second half of first day and on second, third day, the color is bright red. And sometimes the first day blood color becomes a bit dark. In that case, where the previous period was not clear enough, that is old blood, indicative of old blood. But usually in second, third days, the color of blood should be bright red. That is fresh blood. And towards the end, of course, the color will again fade. That is normal.
Fair enough. Thank you. There's some questions about pain during periods. Vipash, would you like to take them?
Yes.
There's a lot of questions about why is there pain, and is pain bad, or can I take painkillers?
That is the pain. There are several reasons. Hormonal reasons, prostaglandin is there, role of prostaglandin is there, and more frequently there is clot colic. Because if there is formation of clot and if it cannot come out at the same time, it gets obstructed in the uterus at the in the beginning of cervix, then there is clot colic, and that is that causes pain. We doctors usually prescribe some dicyclomine group of medicines for antispasmodic tablets, which dissolves the clot as well as reduces the pain. This is the main reason of clot. Of course, if there is associated any other diseases like fibroid or something else, then the pain will be more, or endometriosis, if that is detected. That is some different topic. Usually, normally during menstruation, there is pain on first 2 days, especially more pain before the menstruation starts. And then if you take the medicines, antispasmodic, it won't harm you. It will relieve your pain and the blood flow will start.
Thank you, Piyushini. Thank you very much.
There is no blood, the less blood. That is the main thing.
I'll move to Dr. Nirmala Pipara. Nirmala, we have some questions here in the chat box which I want you to take on. Can UTI effects, can they spread to the vaginal tract or otherwise? From urinary tract, can you have vaginal infection? And from vaginal tract, can you have urinary infection? There's a girl who's asking that. And having inconvenience in urination and having problem with vaginal discharge. If you want to just highlight those points, Dr. Nirmala Pipara, you have to unmute yourself first. Unmute yourself first. Yes, you're audible now. Yes.
Many students get frequent UTI and abnormal vaginal discharge. We should keep it in mind that the two places are quite nearby. And so a hygiene of the vulva vagina is very important. After going to toilets, every time we should clean the area with water. At the time of taking bath, we should keep the shampoos and the things which are available for vulval sanitization should be kept in mind. And it should be dried after the cleaning the particular area. And if the person is having urinary problem, then one should go for a routine urine examination, because there can be slight infection because of the nearness to the vaginal canal. So anytime when the patient is having difficulty in urination, one should get a urine examination done, and proper menstrual hygiene or vulval hygiene should be maintained. We should avoid using our jeans and undergarments again and again before. We should wash it every day, and it should be, even if the jeans are new and we don't want to wash it, then I advise them to iron it first and then to reuse it. Otherwise the germs from the vulva may get transferred to the urinary tract and cause infection. And too much use of sanitization should also be avoided, because they will kill our normal protective soldiers of the body. Normal lactobacilli will also be killed, and so too much cleaning, too much use of sanitization should also be avoided.
Bashab, here
Yeah.
I have a point to add.
Please
The
do. Please.
Yeah, the first thing is that they should also, the menstrual hygiene is very important, and you should change your pads. Wearing pads for quite a long period of time, that may also cause infection through the urethra, right? The sending infection. And sometimes, the pad may not be totally wet, but wearing it for quite a prolonged period, that should be avoided. And using that vaginal washes, too much of vaginal wash will also kill the normal vaginal flora. And also taking plenty of water during this period is very important.
Okay, Dr. Moushami, you're online. There is a question where a girl student is complaining about a dry vagina and a lot of problems of a dry vagina. How would you like to advise her?
Dry vagina, they should not use those. Sometimes they use for removal of hairs and different vaginal washes. So if you don't use them, I don't think that there will be dry vagina in this age group, provided the hormone levels are okay. If there is no hormonal problem out there of estrogen and other problems. So dry vagina is very uncommon until and unless you use artificial things and other things to take care of the vagina and also hair removers.
I think it's very important that naturally there is vaginal secretion which keeps the vagina moist, which keeps on happening throughout the month. So a dry vagina is often, we hardly see it, but it could be a sign of infection also, where the infection is there, which needs to be corrected and which needs to be treated. Also, there's a question, the duration of bleeding. Dr. Moushami, they're saying about 8 days, 10 days. Is it a normal to have a period for 8 days or 10 days? If you can have some discussion. Dr. Moushami.
8 or 10 days is too much. Now it's very important to maintain a menstrual calendar for this adolescent age group, and when the duration of days or the amount of pads that you're using, Nirmaladi has already said. So if those things increase, then it is better to consult a doctor, because we have to do a sonography, or we have to check the thyroid or other blood parameters like PT-INR and other things of excessive periods or heavy bleeding. That thing has to be excluded. And so prolonged periods should be taken care of, and menstrual calendar is very important of this adolescent group.
Okay. I'll just share the screen, and for last few some more discussion there. So I think we had a request from the school to talk a little bit on the COVID crisis, and we have our psychologist here, Shomdata Banerjee, who we want to bring in here again. And there is important issues here. There are student dilemmas, like 16-year-old Mr. MR is unhappy that he has to stay at home all day, cannot go out to meet his friends. He feels stifled and suffocated with online classes, schools, and tuition. So living in just within four walls, not seeing the outside environment for months is not something which people have been used to. And this is something which is going against a section of students. 15-year-old Miss CD is missing out on the family holidays she used to enjoy, and she cannot go out to eat in her fancy restaurants with her parents. She feels depressed and sad. Homemade food and home time all the time. Again, these are issues which some of you can relate to, and that is the reason why we put it up here. Impact on the students, the COVID crisis. We want to talk about the addiction to technology, the reason now you have to shift to mobile phones and laptops, the social detachment. There are people in front of you on the screen, but they're not next to you and sitting there. So how much difference does that make? Isolation, depression, and behavioral changes. We have got some messages in the chat box with some of the students are already having problems with these types. So can I bring in Shomdatta Banerjee? Shomdatta, can you please highlight on this? How important do you think these issues are, and what can students really do to work around them and to have a better understanding and try to feel better about it?
Thank you so much, sir. Actually, COVID pandemic is first thing I advise the students and that we know that all of us have faced this, and we need to make us understand that it's not only we are having this problem, the whole pandemic. So everybody, at one point or the other, we have felt isolated and depressed. So now the things are going to change slowly. We are all coming back to normal life. So we have to have patience and hold on that, as well as we know like the new techniques have taught us things. You know, we have learned so many things. So why don't we always try to think of the good things that we have got from this pandemic instead of only thinking about the negative things we are facing, like we are not being able to meet our friends and go out like before, but many other good things have also happened. So I think if you always go on thinking negative, it will more lead to a number of more negative thoughts. So better if we can think that what are the good things that we have done. We have spent a lot of time with family. We have spent a lot of time for ourselves, talking to our friends, cooking, doing all the other extracurricular activities for which we never got so much of time when we had our normal school days or our office or our work like this. So it's always that we take the positive side of everything. Like this pandemic has taught us many things. Second thing is that yes, it's very important that like there is a shift place from normal classroom classes like offline classes to online classes. And again, we are coming back to maybe offline classes. That was a steady and slow process, and obviously coming back to normal life again will be a little bit difficult. It will take some time, but everything like a process. So
There is some sound problem.
Yeah. Shomdatta, we are not getting you clearly. We are not getting you clearly.
Yeah, there's a little bit of network issue, sir. I can write the they are ready in the chat box. There's a little bit of network issue happening.
Yeah, if you can keep your video off, I think we can hear you better. I think that sometimes solves network issues. I think she's get disconnected. We'll get her back again, and we'll get her inputs there. Meanwhile, we'll take some of the questions. Yes.
Basov, in this connection, yes. Can I tell just 1 second? In medical point of view, I want to tell the students and the girls students particularly only one sentence: जान है तो जहान है. प्रथमे बेঁচে থাকা, তারপরে সোসাইটির মেশা এখানে ওখানে করা. COVID crisis is such a thing. This restriction has been done by the authority, medical fraternity to save the life of the people. So no question. Later on, when everything will be normal, we'll enjoy everything outside and Basho.
Basho, there are certain positive aspects of it. You know, if you consider the students, they are now doing online classes. So the very much time and the energy they spend of going to school and then coming back and then going to the tuition. So these energy, I mean, is losses much less. You know, now
that is something which you may be thinking. For a school student, they may think that is the fun in going to school, in having in the traffic, getting caught, running with the school bag, entering 2 minutes late, getting a little upset. Those are the fun in life, and those are some things which usually some people will say, that is what I miss. I don't miss the loss of energy about not going to school. So it's again a different ways of looking at things. But as we agree, most of us do say that we have to see the positive side of things. I think that's a very important point, as you rightly put. So what we may see as positive may not be what they think as positive. So they may think about some other positive. You are having a lot of time at home. Like Nirmaladi wanted to share something. Nirmaladi, can we hear from you what your granddaughter said today?
I was talking with my granddaughter in the morning, and keeping in mind the evening program, I asked her, Lakshita, tell me, what do you feel about the lockdown and everything today?
How old is she? How old is she?
What the answer she replied to me, I was really shocked. बोले दादी कितना अच्छा हो गया, ना स्कूल जाने का झंझट, ना आने का झंझट, ऑनलाइन पर ही सब हो जाता है, थकते भी नहीं है, मम्मी ने कितना काम करना सिखा दिया. My mom has asked me to do how to manage my wardrobe. I have learned a bit of how to cut bhindi, how to make a roti. So what I felt was that how much time the family members are spending with the children is also very important. Not going to restaurant may be boring, but if we keep on keeping them busy every now and then it will definitely have a positive impact. So she last line she told me that, Daddy, I enjoyed. I never missed anything because हम दोस्तों से भी गप्पे मारते हैं. हम लोग इवनिंग में हमेशा सारे फ्रेंड्स मिलके चैट भी करते हैं, सारे रिलेटिव से भी फोन पर बात करते हैं. जब स्कूल जाते थे तब तो ये सब होता ही नहीं था. तो really I felt so happy to listen from her. She's just 8 years.
Yeah, that's what. So that's something very nice. And again, as we hear positive, I think our psychologist, Dr. Ms. Shomdatta, is having a little problems with connection. I will bring in one discussion, I think, here, which is something which I think before we will go to this, some other discussion before we come back. I think I'll just go through one issue which we haven't discussed here, which is so important. And everywhere where we go for our school, college, and college awareness programs, we talk about this. So vaccines, everybody is talking about a vaccine to save us from COVID, and the COVID vaccine is already here. And as doctors, most of the doctors who are here in your program today in the school have already received the first dose. So do you know of a vaccine that saves you from cancer? So this is something different. So we're talking about COVID, now we're talking about cancer. So there's something called HPV vaccines. I don't know how many of you have heard about it, but it's something which you must hear. So the cervix is one of the organs of the female reproductive tract, which is susceptible to cancer. It is something which you don't always understand or appreciate. You may have heard about the Jane Goody story. Jane Goody was very popular in the reality show of Big Brother in UK, and after that she came and featured the Big Boss here in India. And then she had a fight with Shilpa Shetty, and she made up here, but she had to go back in between because she was detected to have cervical cancer, and she finally died. So Jane Goody, so one in Indian woman dies of cervical cancer every 7 minutes. And it's time to change that statistics. And of the different ways in which you can make a difference is by getting this injection of HPV. So there are 3 injections, best taken between the age of 9 to 45, and intramuscular shots, and a more than 70% efficacy. On this regard, I would like to connect with Dr. Pradeep Mitra. Pradeep da, if you would like, we want to bring you in here. Would you like to talk to the girls about the vaccine, about the HPV vaccine, and how it can prevent or reduce cervical cancer?
Yeah. Thank you. It is a very important issue which I had been also talking while conducting this type of adolescent issues in my early days. HPV vaccine should be taken by every girl in the age span of 11 to 13 years. 3 doses of HPV vaccines are to be taken as a 0, then 1 to 2 months, and at 6 months. If the girl is less than 15 years of age, then even 2 doses are sufficient. It's a very important thing. This vaccine, even if it is not taken by anybody during this frame period of life, it can be taken anytime up to 45 years of age. And then comes the cost. The cost of medicine is around 2,000 or so. But our Indian our Indian researchers, they have come up with a vaccine of our own product, but the price is much less. The trial, phase 3 trial is going on, and that will be available almost freely everywhere in our country in future. So HPV vaccine is very, very important, and every girl or their parents should know that this is only one vaccine at the moment which can prevent from a dreadful disease like cancer of the cervix. That is the mouth of this reproductive organ, as Dr. Basha was showing you in the slide.
Thank you, Goida. Nirmala Di, this is again your pet topic. You also have extensively spoken and worked on cervical cancer vaccines. Can we have your inputs on this topic, and then we will slowly wind up the last part of our program. We're ending up.
I wanted to add something, that if we vaccinate all the girls at the age of 15 years, 90% of the girls won't have cervical cancer in their later life. If we do a single screening program of pap smear of every woman at the age of 35 years, 90% of the pre-cervical cancer will be diagnosed, and the mortality rate from the cervical cancer will be reduced a lot. So there is a necessity for vaccination to all the school-going girls, and the screening of all the girls around, all the women around the age of 35 to 40, to reduce the mortality. At present, previously it was one woman dying in every 7 minutes. Today I've seen the internet, and they say that one woman in every 9 minutes. That means that our statistics is improving, and we yet have to do a more of work on this, more of awareness in the school going girls, so they take the vaccines at the proper time. And one thing more, the country like Australia, who have vaccinated all the children, there is no cervical cancer seen nowadays. So just like we were having smallpox a few years back, 25 years back, if we take care of the cervical cancer vaccine today, we will have the same scenario after 20 or 25 years. It will never be seen, or very little cases of cancer cervix will be seen.
Basho, I have a point here to add.
Yeah.
Hello, Basho?
Yes, please add.
Yeah, actually, not in India, but outside India, the boys are also getting vaccinated. Perhaps it will again come in India soon. And you know, this not only prevents cancer cervix, but it prevents genital warts, it prevents penile cancer, and also many other diseases. So, so we may think of getting the boys vaccinated too very soon.
Yeah.
Very important point.
So I think I'll just yeah, I think that's very important.
Basho, Shomdatta is here. Yeah.
Shomdatta is back. So Shomdatta, what were we discussing when we got disconnected? I think we were discussing the COVID crisis. I'll go back to that slide, and then I'll get you back again. Where is Shomdatta? I can't see her.
Yes, I'm there.
Yes, I can see you now again. Yes, right. Just a minute. You're slipping away. Sorry. Yeah, so fine. So I made you co-host again, and I'll just share the screen. We were here. I think this is where we got disconnected. The impact of COVID on students. We were trying to bring in some points which we got distracted there. And also, I want you to address after this the big elephant in the room. Can we trust an adolescent with unsupervised internet access? This is something which we used to discuss before the COVID crisis. But in COVID, it's become so common to leave an adolescent with internet unsupervised access. How good or bad an idea it is? Can we really trust them? Is the school students the right people to talk to, or should we talk to our parents or talk to the teachers? We want some inputs for you on this regard too. So I'm just disconnecting. I'll just get your, just a minute. I'll just get Shomdatta there. Where is Shomdatta? Can you identify yourself again, please? Did we lose you? No, you're here. You're very much here. Kothai, Shomdatta, can you? Yes, fine. Yeah. Please, can you just highlight the points which we just discussed here?
I think Bharat got disconnected.
I think she's having a problem with the. No, I didn't get disconnected. I just put my video off and thing. So I think she's having a problem. We're not getting her inputs here, and I think those are important inputs to really understand from her perspective. We still have some time in case she's. Yes, Shomdata, can you hear us?
Yeah, I can hear
Yeah.
you, sir. I can hear you.
Can you please highlight on the points which we asked you to, the issues of COVID and the issues of unsupervised internet access in adolescence?
Yes. Actually, because the problem is that when we are talking about mobile phones, the whole world has got digital now. So we have that the use of mobile phones should be restricted. But now, as parents, as teachers, there is no other option. Like they are spending a lot of time on the mobile phone. Whether they are actually doing the online classes or they're just logged in and they are doing something else, that is also very difficult. That is why there is a lot of confusion with whether obviously offline and online classes can never be compared. But as parents, for the higher classes, I'd say adolescent children, those who are here today, for them, my advice will be like, I think they're all matured and responsible by themselves. So they should know that this is not the time when I will be logging in for my class. But maybe first few days it was okay, but later on when they found out still many other schools we are doing online classes, during that time the children must understand
Audio is not
that they are
clear.
not
No. Bashab.
Yeah, it's okay. We'll just try to keep hearing. We will try to keep hearing. I think we've got disconnected.
I'm there, but it's getting disconnected somehow.
I think can you take your video off? Can you put your video off and just go on with the audio? I think it may be a better, yeah. Please continue. It may be better because that's sometimes.
What I was saying is, because till now we as the parents and teachers, we had been advising the children to keep a limited time for themselves on the mobile phone. But because of this whole digital online classes, they are spending a lot of time on their mobile phone. And whether they have logged in and then they're doing something else, it's very difficult. As teachers also, it's very difficult to keep a track. They have logged in, but maybe they're doing something else. So this time, I think for the young, especially the adolescents who are in the high school from 9 to 12, quite matured by themselves by the age of 15, 16 years, they should know that, this is the amount of time I should spend doing my studies. Otherwise, in the initial months, we thought of maybe this is just a 2 or 3 months thing, but slowly the whole world, it's still going on with the online things. Now, if they're logging in, but they're not attending the classes, that will actually do a lot of harm for themselves. And especially when the boards have declared that they're going to have offline examinations, they have to be sincere and responsible for themselves because it's, after all, their career. For the small children, it's very difficult. We know because parents have to be always by the side, especially for the kindergarten school and the nursery kids, those who have not seen the school, physical structure of the school is also difficult for them. Everything is through the mobile phone. For them, it has become actually difficult, but hopefully things are getting better. We are coming back to normal. And so maybe the schools are also going to open maybe as we have started with rotation basis of 10 or 12 children at one go, not together. So mobile phone is a very, very important gadget or device for all of us, not only the adolescents, small children, for adults, for everybody. But we have to understand what are the pros and cons, how we are going to handle the mobile phone. And we should not, mobile phone not control us, rather we should have a control on the mobile.
Absolutely.
Thank you.
Thank you very much. Some very important inputs by Shomdatta there, and I think that's very important for all of us to understand and to take it forward. So we were talking about vaccines. Yes, tell me.
I wanted to add one point. While Mosumi was talking about this HPV vaccine to males, actually I recalled my daughter, she is a ENT and head neck surgeon. She told me a few days back that this HPV vaccine is very important to prevent respiratory papillomatosis, very common disease that's coming up, and it is a very recurrent disease. And this HPV vaccine would be effective against this respiratory papillomatosis in young children and in young adults.
Thank you, Shuranjanda. You had a point. Shuranjanda, you had raised your hand. Is there something you'd like to share with the students here?
Yeah, I like to add that during the adolescence, not only during this COVID, these smartphones create a lot of havoc due to this so many applications of the addiction producing the play.
Exactly.
Addiction to the applications of the play. They are initially they started their learning addiction, going for this play and that play, and they're being addicted. And so much addiction is that they're sometimes going on, pestering on it. If they are asking the parents, if the parents is not capable of doing them the smartphone nowadays is available, and so internet is very easily available nowadays. Very hardly anyone can afford it, and with that application they are downloading it, and like PUBG and whatever it is, they are so much addicted. I know Somdata is very aware of it. It is very difficult to get rid of it. That is a different entity nowadays for the mobile addiction. So if you ask them to mobile date, they are becoming very violent. That creates their distractions from the classes, distractions from the paperwork and everything, and causes a lot of. Particularly, this is very much annoying. I'm very sorry to say this is not only in the gender bias. I'm not doing it. Adolescence is a time they are not going to listen to the elders. They are thinking that their peer groups are their supporters, and all the seniors or what are that they are always obstructing themselves. So this is the only request to my students. Please listen to your seniors and teachers and your parents. What is good for you, what is bad for you, how much you will use it. Just because this is your growing age, and you have to use that smartphones as the technology judiciously, so that in the long run you shouldn't land in a problem. Difficult.
Very important. Yes.
I want Shomdatta to respond. No, I think we'll just get Shomdatta Banerjee to just respond, because there is some of these discussions which we want her interested. Again, if you can keep your video off, Shomdatta, and you have your audio on, I think we can all hear you very clearly.
Yes, sir.
Hello?
Can you hear me?
We can hear you. Yes, we can hear you very clearly now.
Specific question, sir?
No, the question was about the use of mobile phone. Dr. Shuranjan Chakraborty and Dr. Pradeep Mitra was saying, you must use it responsibly. And they were also trying to highlight the universal debate which we have, that adolescents do not listen to adults, their parents generally, and like to have things done on their own. And they usually depend on friends as their more confidantes than their parents and relatives. So some issues, some discussion on that.
Yeah. Actually, as I just now said before, sir, like Dr. Chakraborty, that we should have a control on the mobile and not the mobile phone controlling us. That is very important, which happens for all of us. We know not only the children, those who are listening to me now, I know some of them I can see they're laughing and smiling also, because we know it's very difficult to keep ourselves away from the mobile phone. As adults also, it's the same thing. We are getting addicted to mobile phone every day. There are so many different apps, so many things, one after the other, new things coming. Because of curiosity, we are all downloading. We are into different games, as just now Doctor said, that these are actually becoming an addiction for us. So how to have control on the use of mobile phone? So my advice for all the children, those who are joining the session, that try to do one thing, children, like please try to keep yourself away for at least for some time. Because already, you are giving having a lot of screen time, studies, extracurricular, everything is happening through your mobile. But just if you think that, okay, in the evening or maybe a point of time when I will not touch my mobile, I will be having that much of self-control and willpower that for at least half an hour, I will not touch my mobile. Instead of that, using mobile at that time, I will do something else. I will do something, maybe I cook a small dish for my family or my parents, or I do something, I do some other extracurricular work, whatever you feel like. Apart from mobile phone, there are many things in the world where we can get happiness from. So that will be my advice for the young children here. Try to have a little bit of control on yourself, because, otherwise if you're not checking and controlling now, it will try to control you in the future. So that is very important. But yes, parents also play a very important role. Parents must be beside the child. It's not that they're using continuously or scolding the children, not like that. You have to be beside, because adolescence is a very crucial age. We call it as a period of storm and stress. We know a lot of changes takes place.
Pradeep, come in. Then we'll have final comments from Moshe before we close this session.
This is now so far so long we are discussing the psychological problems related to mobile and psychology of the kids. Now I am talking about some clinical aspects. For the males, first, where to keep the mobile? If he keeps in the pocket the electromagnetic waves that are emitting from everyday upgrading mobiles, those are determined very much destructive to their sperms, testes. So in future, there will be more chance of male fertility of those boys who keeps their mobile always in the pocket. So mobile is to be kept as far away from the body as possible. Second point, this electromagnetic waves also destroys the ovaries. So the chance of fertility in future is also at stake due to too much use of that mobile. Thirdly, the use of mobile close to ear. They should use the mobile using headphone as far as possible and not using too much of for a longer time. So that is one important area. Otherwise, it will cause headache and other brain-related problems. And never keep your mobile for charging when you are sleeping just beside your pillow. That is another important area I think the student must know, and they should avoid all those issues to avoid the clinical scenario, bad scenarios which is supposed to come due to usage of this mobile.
Thank you. Moushumi, I think we'll have the last comments from you and then we'll close because we have already overshot time by 10 minutes and we don't want to go more. So you please keep your concluding remarks and please then we'll close the session after this.
Yeah, the thing is that regarding mobile, I just want to say that there is a certain role of the parents also. The first thing is a very habit. If the children say that the parents are spending more time with the mobile, so that is another thing. Next, the parents sometimes for the little girls, you know, they turn on the mobile and then they start feeding. So that is a problem that starts from a very little and tender age. And for the smaller children, you know, you can stop using books. You can do your studies or through the mobile itself. So that to bring the child out of the mobile. I mean, you have to use the mobile with the children in the correct way. And now we pass over to the, it was a wonderful session, Bashrob. I hope everyone has enjoyed with a lot of take-home message. And now may I request from the school for the vote of thanks, and finally we will be giving our vote of thanks. Hello?
Yes, ma'am. Yes,
Yes.
thank you, ma'am. Yeah, thank you very much, ma'am. On behalf of the school, first of all, it was really a very informative session, not only for students, but for all of us here. I'm here to propose the vote of thanks, and it is really an honor for me to thank the entire faculty, the panel of eminent doctors and psychologists who have contributed through their discussion to make this evening an informative evening. The students have really benefited from the vast knowledge of the speakers on some of the pertaining issues of the growing children, speaking on anemia, nutrition, health, physical body, COVID-19, some of the important topics for the growing children. All this would help the children to create an awareness among them, and also they had a session on some of the issues and problems which they always wanted to know. I would extend my heartfelt thanks to the entire faculty members of Bengal Obstetric and Gynecological Society present here. Ma'am and sir, thank you very much. You all have taken out an evening for the webinar from your busy schedule. On behalf of Saini International School, I would like to thank the Public Awareness Committee who have organized today's webinar on health awareness. I would like to thank each and every speaker of the evening who spoke on various important issues today. I would like to thank the moderator of the evening, Dr. Bashab Mukherjee. Thank you, sir, for moderating the entire session flawlessly. I would also like to thank my sincere thanks to Dr. Moushumi Mukherjee for organizing this educative session for our school students. Thank you, ma'am. I would also like to thank the Honorary Secretary and other dignitaries of Public Awareness Committee, a subcommittee of Bengal Obstetric and Gynecological Society. I would also like to thank over here CEO ma'am, Shoma Devnath ma'am, who had come up with the whole idea of having this informative session for our students. Thank you, ma'am. I would like to thank our principal ma'am, Nobinita ma'am, for coordinating the entire program. Thank you, ma'am. And at the last, I would also like to thank all my colleagues and our dear students who have joined this webinar and make it a success. Thank you, everyone.
Thank you very
Thanks
much.
a lot.
Thank you, ma'am.
Yeah, so we need a feedback from your school for our platform, Bengal Obstetric Gynae Society. You can send it in a mail also to BOGS. And may I take the opportunity of thanking the CEO first, Shoma Devnath, and then the principals, Mrs. Nobinita Giri of Howrah, GM Leena of Maheshtala, the coordinator Sanjita, and Diadash. And yes, ma'am, do you want to say anything?
Yes. Actually, ma'am Dia Das is also there on behalf of Mahesh Tala School. She would like to say a few words.
Okay.
Yes, ma'am.
Thank you, ma'am.
Good evening. A very good evening to one and all present here. I'm Mrs. Dia Das, the Senior School Coordinator of Saini International School, or you can say MLZ is Mahesh Tala. And definitely, I would like to express my heartfelt thanks to the entire panel of dignitaries from the Bengal Obstetric and Gynecological Society for conducting such a wonderful and informative session. I would also like to take this opportunity to thank Dr. Bashav Mukherjee and Dr. Moushumi Banerjee for giving their valuable time by organizing such a wonderful and enlightening webinar for such important health issues. Such important health issues are definitely in the contemporary time. Last but not the least, we would like to thank Mrs. Shoma Devnath ma'am, the CEO of the Saini Group of Schools, and both our principal ma'ams, Mrs. GM Leena ma'am and Mrs. Nobinita Giri ma'am, for such a wonderful opportunity. A very big thanks to all the faculty members of both the schools and all the students who have made this event a big success. Thanks to all of you, and we would definitely love to be a part of such events in future also. Once again, a very, very big thank you to all the doctors, to all the students, to all the teachers, and definitely Shoma ma'am, Nobinita ma'am, and Leena ma'am. Thank you. Good night and stay